Really excited for our next speaker, David Rock, again of the OMC. Very excited. David Rock is the research manager at the Office of Medical Cannabis. He has years of experience working in the Minneapolis Health Department as a researcher and also in the private industry as a business analyst. After a 6-year stint owning and operating a small motel in northern Minnesota, thank you for not putting the town name there, he's back in the public health arena working to improve the experience of patients in the medical cannabis program. Please welcome David Rock.
Thank you. Good afternoon. Well, it's not afternoon yet. It just feels like that. Good morning. I'm going to start out by talking about a few of the quotations we get from our patients. And so first off, Brittany, I don't know if she's still here, but she's downstairs. Thank you for that, because I think sometimes when we're working in the Office of Medical Cannabis, we're working in a state department, and sometimes we forget the impact that our program has on people. And so it's important to remember that. I'll just read a few of these. My pain level is lowered, and with that lessening, I'm less miserable, less angry, less frustrated, and have improved social relations. I cannot say enough how much this program has helped me. I have stage 4 breast cancer, and the chemotherapy causes all kinds of unwanted side effects. Cancer sucks, but this medical cannabis program makes it more tolerable. And cannabis as an alternative to conventional medicine has been a huge positive in most every area of concern for my need. However, the cost, requirements, availability, and location have forced me to reconsider my need for the program. And so these are really the types of comments that we hear often. These particular comments came from a patient satisfaction survey that we did in the fall. But we also get calls into our call center, and people will share these types of stories. And really, the types of stories we hear are along these lines, that either costs are too high for people, or that for some people it just doesn't work, and for other people it's absolutely life-changing. And so you kind of get that spectrum. And it is also important to remember that two people given the same condition who might be taking the same cannabis product don't always have the same end result. For some people, it can be miraculous, and others, they might not continue because, side effects aren't going to be worth it, or it's just not doing as much as they were hoping it would do. So let me talk about the data collection in our program. Minnesota is very different from a lot of the other states that have medical cannabis, and that's because we have a legislative mandate to collect data and to use that data to advance the health and well-being of our patients. And not all states have that. So looking at how we get some of our data. So first off, when patients register themselves into our program, we collect demographic data about them. So this can include their address, their age, gender, race and ethnicity, as well as qualifying medical condition. But we also have other ways that we collect information. Prior to every medical cannabis purchase, patients have to fill out a mandatory form, and that's whether they come in today and they come in 2 weeks from today, they still have to fill out another form. And when they come in 2 months later, they still fill out that form again. And like I say, that's mandatory. We have some optional surveys that we ask them to fill out, and those go out at 3 months, 6 months, and 12 months after they first enroll. And even our healthcare practitioners are asked to fill out surveys at 6 months and 12 months after they enroll a patient into our program. And then just last year, we started doing patient satisfaction surveys, not only satisfaction surveys with our patients as well as with our healthcare providers. Next year, we're hoping to include some type of quality of life, and we're probably going to be using the World Health Organization's quality of life. It's their abbreviated version, which is 26 questions. But we also want to do a discontinuing use survey. So this is going to be done so we can help understand why patients might make their first purchase and then never make another one again. And that could probably be because the costs are too high, they don't want to continue. It could be that their condition has changed dramatically, or it hasn't been doing what they hoped it was going to be doing. But we're going to try to put that in the field in 2023. So back to the mandatory form, I just want to show you the types of thing that we collect on that. And this is the form, as Natalie was saying, that the pharmacists use as they're determining what products are best for a patient. So we ask about current medications, their current medical conditions, and then we ask about these 8 areas of symptoms, and we ask them to rate them on a scale of 0 to 10. So we ask about pain, nausea, anxiety, depression, fatigue, disturbed sleep, lack of appetite, and vomiting. In addition to that, we ask about benefits and side effects of their medical cannabis use. Also, we have a list of 31 different symptoms that they might be experiencing, and we ask patients to tell us which ones they experience, and then we ask them to rate them as whether they're mild, moderate, or severe. And these are 31 symptoms that we looked at literature to see which are the most common ones. But you can see it includes dizziness, tiredness, dry mouth, things like that. So that's kind of the basic form for patients filling out this mandatory form. But then, since we know the qualifying condition for each person, we ask just 1, 2, or 3 extra questions for them. And so if their qualifying condition is muscle spasm or ALS, for example, we'll ask about spasm frequency. If they have seizures, we'll ask about seizure frequency. And any of these other 8 conditions, they get 1, 2, or 3 extra questions that we ask. So in addition to those mandatory surveys, we have optional surveys that we have patients fill out. And these are done at regular intervals. We do it at 3 months after their first purchase, 6 months, and then at 12 months. So all patients get asked about, again, the benefits and negative effects that they have from their cannabis use. And this includes, then specifically, we ask about physical side effects, mental or cognitive side effects, worsening of symptoms, and accessibility of medical cannabis. Those are the core ones. We also ask patients specifically if they have PTSD. We have them fill out a PCL5, which is a standard questionnaire. It has 21 different common effects of PTSD. And we're asking that at enrollment, at 3 months, and at 6 months that they fill those out. And then patients with autism are asked to fill out the ABC2, which is an aberrant behavioral checklist. And that has like 51 questions that asks about behaviors. For the most part, it's about their child, but we do have adults who also fill it out for themselves when they're in the program. And I have to say, the mandatory surveys are great. We get all sorts of answers from that. When it comes to the optional surveys, we find that at like the 3-month follow-up, about 50% of the people will respond with those. And then at the 6th month, it's about 50% of that 50%. And then at a year, it's 50% of the 50% of the 50%. So it goes down. In the coming years, we're hoping to try to implement a different way of collecting the data that I think will be a little more successful at increasing our response rates. We don't just ask patients, surveys. We have optional surveys for the healthcare practitioners, and these are done at 6 months and 12 months. And here we ask about, again, the benefits associated with medical cannabis use and the harms associated with medical cannabis use for the person that they enrolled into the program. And so what that enables us to do is we get a look at what patients are saying and what healthcare practitioners are saying. And I'm just going to show you this one. This is a graph of, these are intractable pain patients, and the blue columns are what our patients respond. The green columns are the responses from our HCPs. And what it is, it asks the benefit you receive from using medical cannabis. 1 on the far end is there's no benefit, all the way up to 7 being a great benefit. And what you can see is our patients, the vast majority, 37% are rating it the highest, 7. It's great benefit. But even there's a lot who rate it as a 5 or a 6. So they're really seeing benefits. From our healthcare practitioners, it all gets subdued a little bit. They don't necessarily see the same level of benefit that their patients receive. But I have to say, this is just one look, like a simple look at this data. We can look at it for, this is intractable pain, we can look at it for each of the different qualifying conditions. But what we find is this general tendency is similar across all the other patients, all the other conditions. Now, we want to go more into depth in this, which we haven't been able to yet, because it's very possible that patients who are having a lot of benefit are more inclined to answer our surveys and are more part of our program, are engaged with us, whereas with the healthcare practitioners, maybe it's the one who aren't seeing as much success in their patients or more apt to reply. But we're able to look more into that because internally we can match up these questionnaires with a specific person and see differences there. We also are very interested in adverse event reporting, and we use Safety Call International. And I know that later today, somebody's going to be talking specifically about Safety Call International, so I'm not going to go into it here, but we do rely on that to keep track. But we do also, besides that, we collect data about the adverse events. But for the most part, the symptoms or events in the far left column here are the ones that we generally see. And that's dizziness, fatigue, dry mouth, etc. And it's something like, Chris, I don't know if you'll know this off the top of your head, but it's something like less than 90% of our patients have some type of side effect. No, 30% of our patients have some type of side effect at reporting, but 90% of those are mild or moderate. So we don't see a lot of really negative effects with the program. So let me talk about a little bit of how we use our data, the reports that we do, and some of the studies that we have going on. So in the past, we have been writing quarterly reports and annual reports that get put onto our website. And if anybody's interested, they can go onto our website and download this 80-page paper that has all this information, and it's a lot to read through. And so what we're doing this year, we just started at the end of last year, is we're starting to use data dashboards, and we think it's going to be an easier way for people to look at the data they want to look at. And so, for example, this is from a quarterly dashboard. You can see, like here, you can learn about our patients, how many patients are in our program. The next side is looking at returning patients versus new patients every quarter. And then, I don't know if you can see the little blue arrow on the right-hand side there towards the bottom. there's a place that you can download, and so you can download an Excel file that will have this data as well as previous years as well. And so in this way, we're hoping that any stakeholder who needs this type of data will be able to get it. And we're going to do this for our quarterly report. We also have an annual report, and then our big report that comes out about benefits and adverse effects are also going to be put in this type of format as well. We also write up condition-specific reports. So the most recent ones are intractable pain report and a PTSD report. Those came out fairly recently. But later this year, we're also going to have a report about autism and obstructive sleep apnea. And in the following year, we'll be coming out with a sickle cell disease and a chronic vocal or motor tic disorder report. And basically what we do when new conditions are added to the program, we put them in the program and then we wait about a year and a half to collect data on that. And then we have enough data that we can kind of go in and we can talk about what's happening in the first year or so of the new condition in the program. We also look at patient purchasing patterns. So by this, we get data, sales data from each of the dispensaries comes into our Office of Medical Cannabis database daily. And so through that, we're able to describe what products patients are purchasing. And since we know exactly what product that is, we're able to monitor. We have the knowledge of the ratio of THC to CBD in those products. And then we can also look at route of administration. And that's something that's done every couple of years. It's mostly shared with the manufacturers, but it is made available as well. And then we've done some contracted research in the past. Chris mentioned this earlier today that we did a price study with Barry Dunn. And as she said, you know, there was a lot of concern about our prices too high in Minnesota. And so Barry Dunn looked at that and looked across the country. And, you know, there's no one set price for any product. There's a range of prices. And basically they found that Minnesota landed in that range. Sometimes it was on the upper end, but sometimes it wasn't. So it wasn't really out of step with what was found in other states. Not to say that it's not really expensive for patients, because it really can be, but we found that so far we're about in the same range as a lot of other states. And then finally, one of the things we're doing fairly recently and we're very excited about is using our data and sharing that with other researchers who want to look into our data. We have a really easy process for doing that now. Researchers can contact the Office of Medical Cannabis. They'll get sent an application, which is short and simple. And we also will send them what types of data elements they might be able to look at. They fill that out. The application comes to OMC. And then internally, the Office of Medical Cannabis will look at it and see if it's a right fit to work with the researcher. When that happens, a data users agreement is signed between the researchers and myself. And that's when my research unit will then meet with them again to discuss exactly what fields we'll be able to provide them and in what time period we can do that as well. And this has been very exciting for us. So far, we're working with 4 different outside researchers. We're working with the University of Minnesota with Dr. Angela Birnbaum and some of her associates. We're working with Health Partners Cancer Clinic with Dr. Dylan Zilla. He's doing a lot of work, some of which is involved our data, but otherwise he does a lot of different work with his patients who use our program. We also have Dr. Natalie Schmitz, who's just up. She's with the University of Wisconsin-Madison. And then just this week, we signed a data users agreement with the Mayo. So Doctors Vlad Popescu and Paul Corkin are 2 of the physicians from Mayo who are going to be using some of our data as well. Let's see. that looks like that's it for my slides. It basically was it. I was just going to say that some of the other things that come out of when we have work with researchers are peer-reviewed journal articles that have come out, and some of my staff have been parts of those in the past, and we're looking to be parts of that going forward. Because we really feel that part of our legislative agenda for us is to increase the knowledge base about cannabis use, medical cannabis use. And we feel that in our state, we're really positioned in a way that we're collecting data and we can be able to use it to increase that knowledge base. So that's my presentation for today. I don't know if anybody has any